Prescription refills are where you get your biggest bang for your buck in the Entergy system.
I hardly ever have to sign my name because of the prescriptions are going electronically, and that was something that was a constant interruption, was to be signing so many prescriptions and having this go automatically.
Just being able to receive labs and efficiently being able to navigate the patient's record, to be able to decide on how to react to abnormal labs has been very efficient for us.
All our labs and most of our path reports come directly into the system, and so it's a one-step process in the fact that you're responding to the task of interpreting that laboratory data and responding to the patient at exactly the same time.
We are involved for the past 3 years in a medical home model pilot program, and the software has been very useful to us in being able to pinpoint areas in which we can intervene so that patients can receive timely services and then result in not reducing readmissions, making sure that patients receive the services that are required, and then aggregate this information and report it in a way that is very cost effective for us.
And with Sage, it really makes financial reporting a pleasure and optimizes finances for a practice.
A lot of rejections occur because we have a breakdown between the front desk and the billing department, or the front desk and the doctor filling the papers out incorrectly. So by having an integrated database, everything's kept up to date.
And we've been able to do some comparative analytics using the practice analytics tool that lets us look at the physicians in the practice against their peers in the same specialty to ensure that the coding is pretty much on the same level in terms of the physician coding.
We were really interested in the practice analytics because it gave us the flexibility to do reporting the way we want it done, when we want it done.
One of the areas that we see that has been very useful is the report writer, where we're able to not only see information on a patient-by-patient basis, but we're able to see information across all of our patients so that we know where there are trends, and it helps us tremendously in our planning process. In fact, the information led to us revising our whole collection policy.
When the claims are processed in the evening, it goes through the initial scrub, so usually if there's anything right off the bat that was missed, it is caught before it actually transmits out in the evening, so we don't have to wait for the denial to come back.
Claims are more accurate because, number one, you've checked eligibility before the patients ever come in.
The claims processing turnaround time, we used to be probably at about 60 days on average, some 40, but now our average gross turnaround days is usually around 25 to 28 days.
We see the data, more timely. I think there's the ability to drill down to levels that, historically we weren't able to, and hopefully, that's going to mean a lot in terms of revenue capture.